Let's also go across to experts joining us. Dr. Arjun Dang, CEO of Dr. Dang's Lab, is joining us on the broadcast along with Dr. K.K. Agarwal, President of Heart Care Foundation of India. Dr. Arjun, 14 Italian tourists have now tested positive. Now, that is likely to spread some sort of a fear, coronavirus scare amongst Indians now.
Yes, definitely, but this is not the time to panic. It's more of bearing precautions and spreading awareness to maintain hand hygiene, respiratory etiquette, and also spread awareness among our fellow family and friends to avoid overcrowded places, to avoid any unnecessary travel. And keeping all these things in mind, we as a team can fight the coronavirus that has started now very effectively.
To remember that these individuals, these tourists are in the quarantine ward. They have been kept in isolation. So we don't need to worry about that, but we do need to take basic precautions because one at this point in time does not know how many individuals may have come in contact with these tourists.
That's right. You can never be sure who the person has actually contacted, but we can take our own precautions to prevent any kind of spread to us.
Now, what kind of precautions are we really talking about? Now, since morning, of course, we're discussing how basic hygiene needs to be maintained, and there are several suggestions. I'm sure home remedies also that are being suggested for individuals to follow.
Yes. So basically the points of precautions everyone's been talking about and most of the people already know, but it is more of hand hygiene, that you keep your hands clean, wash them with soap and water, use alcohol-based sanitizers when soap and water is not available. Also respiratory etiquette, that is when you cough or you sneeze, you fold your elbow and you cough and sneeze in a handkerchief or a tissue paper. Apart from this, there are multiple remedies that are being suggested, but none of these actually have any scientific data behind them. So the best would be to avoid overcrowded places, also because the festival of Holi is coming up. It is just around the corner. And I would suggest that celebrate Holi with just your close ones at your home. Do not go to overcrowded places and avoid any unnecessary travel. Apart from that, stay hydrated, stay well rested, stay at home, and only travel or go to crowded places when extremely necessary. Anyone who's coughing, anyone who has fever, anyone who has any symptoms of any flu should see their general physician immediately and seek their advice.
Right. Now, since we've also been discussing the symptoms of coronavirus, it's not just cold, cough and fever, but breathlessness. But how do you suggest the asthma patients need to, take precautions?
So again, the same protocol that is being followed for the general population that I just told, asthmatics can also do that. Obviously, shortness of breath usually comes at a later time. It starts, like you said, with a mild fever and a cough and flu-like symptoms, maybe a headache, maybe the tiredness that you usually get, maybe a sore throat. But yes, breathlessness does come at a later time. Asthmatics, it would be best if they remain indoors where the air quality is being monitored, and that's why they would have a lesser chance of contracting the infection.
Right. Now, just for the understanding of the viewers, individuals who are being sent to the quarantine wards, what kind of treatment are they being given? What happens in a quarantine ward?
So in a quarantine ward, basically the primary purpose is isolation, so that they don't come into contact with other people and spread the infection. Like we already know, coronavirus is extremely contagious. It's a droplet infection, so it can spread very, very quickly. So in a quarantine ward, apart from isolation, we monitor the patients regularly. So the temperature is checked at every few hours. The other vitals are also monitored to see if they're developing any symptoms of the infection. Also very important currently, once any kind of symptoms appear, they undergo a testing. The testing is basically started by a screening test. This is a real-time PCR-based test that is also followed by a confirmatory test. So only when we get the screening and the confirmatory test is positive do we label it as a coronavirus positive case. And also anyone having symptoms, currently there is only symptomatic treatment. So medicines for fever, maintaining hydration, etc.
Right, but then, and let me go across to Dr. K.K. Agarwal, but then Dr. K.K. Agarwal, there are some asymptomatic carriers as well that is even more dangerous, and the fact that an antidote hasn't been found makes this virus very, very dangerous in nature.
So the important thing is that why should any patient who has no cough spread the infection? And asymptomatic patients are less than 1 or 2%. So our most important thing is fever with cough, dry cough, persistent cough. That is more important, with and without breathlessness. 80% will have cough and 30% of them will develop breathlessness. So unless, even if you have breathlessness, it may be mild. If you require oxygen, you require hospitalization. If you require ventilation, you require ICU care. Otherwise, this will remain as a mild disease. Most important thing is to remember 3 C's. Identify the first case. If the first case is identified, that is C, do not let a cluster develop. Cluster means secondary infection from person to person. And even if a cluster develops, we have to prevent a community spread. That means a person getting infection without in contact with a COVID-19 patient. So therefore, at this moment in India, we have 6 cases, out of which 3 are active. All 3 of them are in 3 different places. So they are cases. Now we have to trace the close contacts so that we can prevent them formation of a cluster.
As far as the confirmed cases are concerned of Indians, that has, I believe, risen now. There is 1 case reported from New Delhi, 1 from Telangana and 2 from Jaipur. The individual who was infected in Italy, his wife is also found to be positive now. And then there are 15 Italian tourists who have been kept in the ITBP's quarantine ward in Safdarjung. So that number has risen. Is that alarming?
See, I know. If as on today, as of now, government has only declared 3 cases. The 4th wife cases is still under a confirmatory testing, and all other delegates whom government has said have a high viral load, they are still under a confirmatory test. If you find a cluster of cases, that means if you find 6 or 7 of them who becomes positive, then we say from an individual case it has now become a cluster. When it becomes a cluster, we are concerned, because now it can end up into a community spread. So there are 3 stages of spread. One is a case, individual case, then a cluster from case to case, and third is a community spread where it goes by the contact, not by the droplet. Because, for example, I have coughed on a table and somebody comes on that table and carries the infection, he hasn't contacted me. That becomes a community spread, which has happened in America, which has happened in all the countries where there are large number of cases. So at this moment, the government has only declared individual cases. 1 cluster of cases in Agra is under investigation. If that becomes positive, we are concerned.
Absolutely. And you know, are the doctors also themselves kind of keeping an eye on patients that they are receiving on a daily basis? Is there some sort of a protocol that the doctors have decided upon? Let's say if individuals are showing symptoms of fever and cough and cold, normal symptoms, are they being suggested to undertake the test?
I am concerned because till yesterday evening, Indian Medical Association has not been called for any discussions by the Ministry of Health. I expect it today. And if that happens, there will be a common protocol. Otherwise, there are multiple protocols running. Private sector is having their own protocol. Whether that is matching with the government or not, we don't know. So therefore, I expect today the Ministry of Health to call Indian Medical Association for discussions, because 80% of the treatments are in the private sector.
Right. Let me also go across to Dr. Arjun. Dr. Arjun, of course, we're waiting for that press conference that the health minister is going to address for more updates on whether this number has risen, the official figures. That's what we want to know from the government and the kind of preparation that is being done to receive such patients and keep them in isolation or maintain, a close eye on them, monitor their situation. But what at this point in time, what we don't know is all those other individuals. Some have been tracked by the government. There must be many others who may have come in contact with these who have been tested positive, and they should take precautions now.
Yes, that's right. So what you're saying is basically contact tracing. That is, whoever the person who's infected has come into contact with should be quarantined and should be monitored very regularly. Also, what we must keep in mind that testing facilities that the government has provided currently are 17 in number. These are government institutes that are placed in various cities, and these are being headed by NIV, that is National Institute of Virology in Pune. But as the time comes and as more cases, unfortunately, if they get infected, then the government must take measures to increase the bandwidth of the testing capabilities.
And the labs as well. I think we need to do that as well, because not every sample can be sent to Pune, to know whether it's confirmed or not. We need to have those labs in every state, I guess.
Yes. So NIV Pune is heading the testing, but there are close to 17 centers. For example, in New Delhi, you have Safdarjung and you have NCDC that are doing the testing. In every city and state, there are a few nodal centers where testing is being done. But obviously, if cases increase, the government will have to ramp up this number of 17 to a much higher number. And even the private labs can collaborate with the government effectively to provide increased accessibility to the patients. But while doing testing, we must keep two things in mind that are extremely important. One is obviously the infrastructure capacity regarding the equipment and the quality of technology that is being used, and also the safety norms that are being followed. From the time the sample is taken till the sample is discarded, very strict safety norms are to be performed in order to contain the spread of the infection.
Absolutely. Thank you very much, Dr. Arjun and Dr. Agarwal. I think Dr. Agarwal wants to make a point. Quickly, sir, before I wrap up. Yes, quickly, sir.
I just want to make it that isolation and no cohorting of contacts. Today, we are in a stage of either a case, individual case, that is an index case, or we are at a stage of a cluster of cases in Agra. Therefore, quarantine must have a isolation not only of the patient but also of contacts.
Right.
Cohorting them may end up into a problem, because Japan did cohorting in the ship of all the patients together, and we had 23% infection.
Well, that's a very important suggestion. Dr. Agarwal and Dr. Arjun, thank you very much for joining us on the broadcast and letting our viewers know the kind of precautions they can take.